Welcome everyone to today's webinar, The Surprising Link Between Integrations and the Patient Financial Experience. I am Aaliyah Pavla with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Chris James is Patient Co's Vice President of Customer Success. Before Patient Co, Chris worked at Athena Health with clients in unique payment models and emerging technologies like telemedicine. Chris has also worked in managed care consulting, where he gained experience in payer processes and claims management. Mike Sims is the Vice President of Revenue Cycle at Cone Health. Mike Sims joined Cone Health in March 2013. In his role, Mike is responsible for patient pre-services and access, hospital and physician billing, collections, and customer service. Cone Health is a nonprofit 6-hospital health system with 1,253 beds, along with various outpatient clinics and over 400 employed physicians. Andrea Mejia is Piedmont Healthcare's Executive Director of Patient Financial Care. With over 25 years of revenue cycle experience, Andrea leads Piedmont's patient access and customer service team. She is passionate about strategy development and operational improvements that create value and results for the organization, team members, and patients. Prior to Piedmont Healthcare, she worked for Tenet Healthcare and several other nonprofit hospitals. John Staffioti is the Director of Operations Consulting at INSPIRA Health Network. He began his career at INSPIRA Health in 2011. He strives for continuous improvement, creating a more efficient, innovative, and cohesive INSPIRA. In this role, John collaborates with department leaders to develop creative or hidden opportunities for cost reductions or improvements. He maintains a diverse project portfolio that consists of patient throughput, expense reduction, revenue enhancement, program design and redesign, as well as data analytics. At this time, I am pleased to turn the floor over to Chris to begin today's presentation.
Thanks, Aaliyah, and thank you so much to the Becker's community for allowing us to take your time today and talk through some of the really interesting stories that Patient Co and these wonderful clients have been able to create together over the past few years. As Aaliyah said, the theme today is the surprising link between integration and patient experience. And so what we're going to do is treat this more or less as a panel discussion among this crowd, and we really want to take you guys' input throughout this process as well to talk about some cases, some problems to be solved, and as we get towards the end of the conversation, really look towards what are some of the next steps within the healthcare revenue cycle landscape that we collectively need to address in order to make sure that patients have the best financial experience. Before we kick in, we're going to go through and just do a little bit more of a deeper dive on background and introductions of each of the health systems, really framed around what the health systems have achieved with Patient Co. And then we'll get into a little bit more background and dig into the questions. First, Patient Co. For those of you who aren't familiar with us, we were founded in Atlanta in 2009, really out of that need that I'm sure many of you have experienced before of having a better way to pay patient bills. Our CEO was a new father and facing the issues of juggling medical bills and trying to understand what everything meant, and that really prompted us to create this company. We're currently in over 3,000 active healthcare locations across the country. We serve over 20 million unique patients, and through our payments platform, we process over $1 billion annually. Among many awards, which we're proud to tout, we are a MedTech Breakthrough Award recipient, and we're also just very proud to be here today. Mike, can I flip it to you real quick to just give a little background about Cone?
Sure. Thanks, Chris. And thank you, everyone, for attending today. Cone Health is based in Greensboro, North Carolina. We recently had some exciting news, our pending merger with Centera in Norfolk, Virginia. And so we're going to be a larger organization because they're larger than us, and we're very excited about that merger. We're on Epic. We've been on Epic since February of 2012. I came here in 2013, so I was not here for the conversion. We've been a client of Patient Co's since 2014, and let me tell you a little story about that. I've been in the business for over 30 years. In fact, I used to work with Andrea Mahea at Tenet, and so it's a small network we are in. And I never heard of Patient Co. And I was going through LinkedIn one day and saw this interesting article that Patient Co. had posted on LinkedIn. And we called them in. We were looking for a new statement vendor and payment processor. And so we found them by mistake or luck, if you would like to call it. And ever since that time, we've had a wonderful connection with Patient Co. The thing about Patient Co. that you'll get to know about is they listen to their clients. They don't have all the answers. They want help from their clients. And we've been able to help them improve their product over these years. And that's what you want in a true partner, somebody that doesn't know everything and is willing to talk and listen to the client and improve their product.
Thanks, Mike. Appreciate that. I think we've got some activity going on the deck here. John, would you mind giving a little background on INSPIRA?
Sure, absolutely, Chris. So again, my name's John Saffioti. INSPIRA Health Network, we're about a 3-hospital system with about 150 total access points. So we have a little mix of everything. Hospital-based physician practices, urgent cares. We have PACE program. So we have a little bit of everything. We're actually on Cerner. The hospitals are on Sorian, and our physician practices are on Millennium. We've been with Patient Co. Since about 2018. And, you know, I just want to kind of reiterate what Mike said. I think he hit the nail on the head when he said Patient Co. Is a true partner. They don't always have all the answers, but the flexibility and just kind of coming to the table with different solutions as the problems arise has really been a huge plus as we've been getting to know Patient Co. over these last couple of years. So our experience has been very positive as well.
Thanks, John. And Andrea.
Hi, everyone. About healthcare, we now have 11 hospitals that are part of our health system, and we're in over 650 locations throughout Georgia. So we have a large physician organization in the metro Atlanta area and actually expanded to many markets throughout Georgia at this point. We, too, like Cone, are on Epic and have been an Epic client now for many years. Our entire system is on Epic. And so our partnership with Patient Co. As a single provider for our payment processing was a nice match for us as we continue to enhance the way that we service our patients. We've been with Patient Co. now since 2018 and really have seen some fabulous results. They are a partnership, as you already heard from previously, and they continue to align with where we want to head from the patient experience. So some of the results that we have seen already organizationally is really that shift to patients engaging electronically from their patient statements. So we are seeing 49% of our patient bills actually be presented to the patient digitally now versus having to mail the patient. So that next evolution of that experience for the patient. And then also just the growth and adoption that we've had with our patient wallets. So we've got over 200,000 of our patient guarantors are actually on patient wallets. So phenomenal adoption that we've seen in our patient population. It's been a pleasure so far to have that available through Patient Wallet and Patient Co.
Great. Thanks, everybody. Really appreciate the background here. As we move into the discussion part of this session, I wanted to set the stage real quick about how Patient Co thinks about integrations. And for us, we've got two key themes. The first is related to payments. We have an incredibly robust payments infrastructure that's built into our product. It has a number of benefits. You can read through the bullet points here. I won't bore you all, I promise. But the key themes as you look at that for our health system clients really stand out in two key areas. One is PCI compliance, and the other is payment reconciliation. By Patient Co being that integrated payment platform, we take on the majority of the payment work, and it also means that we have an end-to-end look at the payment landscape. So when a payment is processed, it is going through Patient Co, and we can tell from that click of the button in Epic or in Patient Co or wherever it may be, from all the time from the end of the process to where it gets settled and posted back in the bank, we have eyes on that. And that allows us to partner with our clients and make sure that they've got a clean look at the banking landscape and that they've got clean reconciliation, and they can have that true keyway point of saying, this is what I see in Epic, this is what I see in Cerner, this is what Patient Co says, and it's a source of truth. And then similarly, by us taking on that payment burden, we drastically reduce the PCI scope of our customer base that are using us. And so from a revenue cycle perspective, from a health system perspective, it's a peace of mind, and that also translates to the patient side of things. It's easy, it's built in, and it's seamless. This is admittedly the integration component of it that's more behind the scenes and maybe doesn't jump out as much, particularly as we're thinking about patient experience. But it's important to highlight that as the underlying infrastructure that goes into it. And then, of course, we look at the other piece. And I think as we look at this slide right here, which is that vendor ecosystem integration, the HIS integration, this is what's probably more familiar to most of us. Hundreds of different tools out there that everybody's using. And we're not naive enough to think that there's a perfect fit for every health system. Depending on your community, depending on your needs, depending on your budget, there's all kinds of different tools that a health system needs in order to serve the patients. But the question comes down to, what are you doing to make sure that from a patient-facing perspective, they're not getting lost in that confusion and shuffle? And so where Patient Co fits in is really blending those key patient-facing activities into a single platform, right? We take over the communication. So be it email or text or paper, patients have one place to go for their financial transactions that occur with their health visit. Similarly, they've got one place to go to pay all their payments. So we act like an umbrella that sits over everything so that regardless of whether or not one hospital is Epic, another might be Sorian, another might be Millennium, what are we doing across the board for the patients to make sure that it doesn't look different to them? And then finally, on the staff side, it's crucially important to make sure that all of that data is synthesized and put into a way that the staff can easily work with it. So managing payment plans, managing questions, inbound requests, one place to go so that patients aren't getting confused and don't feel like they're getting the runaround as well. So enough of the pitch for now. We'll move on, and I'm going to turn it over to the experts here to really talk into some of the details. I want to pause here, and this might be a good opportunity to get some feedback from the audience as well as the discussion kicks off. But I'd like to go around to the panel and really get an understanding of what was the prior state that was going on within your health system before working with Patient Co, and really what prompted you to look for a change, whatever that may be. Andrea, would you mind if I kicked off with you and gave a little bit of a primer on what Piedmont was doing and what led you all to decide to work with us?
Sure. We're live with Epic, and we had a payment partner that we really felt like had some old technology in play and really wasn't positioned for the future. And so we wanted to have a partner that actually would be integrated in Epic and not have our employees have to experience navigating through multiple systems to actually do our payment processing. So we were focused on just improving that. And then we also wanted to make sure just end-of-day and reconciliation challenges were addressed by not having the multiple sources for that reconciliation process. So that really led us to finding a partner that would come along with us and help us from that future state, that integration, and really what our patients were telling us what they wanted from a self-serving standpoint in the future, because we had a payment online portal, but it was not friendly to our patients. We didn't see a high adoption rate from that. And so really meeting those needs going forward from a consumer standpoint were really important for us at Piedmont.
Gotcha. Mike, mind sharing your story? And if you want to, I'll allow you to highlight the friend you have in the background too on the screen.
Oh, okay. Thank you. Well, that's Bozo, and I've been known to call some people bozos in the past. So, but anyhow, going back to the PatientCo story, we basically had gone through an Epic conversion, and we had a vendor that we had a horrible patient statement. And this is the interesting thing about PatientCo. I always talk to the CEO, Bert Blitch, and I say, you have a wonderful statement. And he says, but we're not a statement company. And he always wants to make that clear. They're a payment processing company also. But we were looking for a wonderful statement, patient-friendly statement. And as I said, we found PatientCo on LinkedIn, and their statement was very patient-friendly, very colorful. The patients can look at the statement and understand it. It's very eye-catching. And so we went through a group of our patients, patient advisory council, and they looked at the statements from a couple of vendors, and they loved the PatientCo statement. So that was one of the solutions we were trying to solve. We wanted to have a patient portal, which we really didn't have a good one. And PatientCo had a patient portal that allowed our customer service representatives to answer messages from our patients, and they can go on to the portal, the patients, and they can send a message to our customer service staff, and we can answer them without the patient having to pick up a telephone. So it's all about patient experience and patient engagement, satisfaction, just like the airlines and the technology that we were looking for. So I think those were the couple of pieces that we really saw that differentiated PatientCo from other statement and payment processing vendors. And the last thing is the integration into Epic was really important. They handle all of our payments, including the credit card payments on the patient wallet side and the lockbox. And it's a very easy process to integrate those payments into Epic, and you also have all of your correspondence scanned for you from the lockbox into the PatientCo portal, so it's easy to establish workflows for your staff. So again, there's many aspects of PatientCo that allowed us to be more efficient and provide better service, not only to our patients, but better service to our staff.
Thanks, Mike. John, I'm going to flip the same question to you, and if you don't mind, I'd like for you to talk about some of the staff experience that you had as well. And we'll use that to segue into the next section and review some of the data from INSPIRA.
Yeah, absolutely. Thanks, Chris. So, similar to what Mike and Andrea stated, INSPIRA, we were going through conversion as well. We moved to Cerner, the Cerner platform, in February 2018. And INSPIRA likes to go hard or go home. So we converted over 20 plus systems all at one shot. And our biggest focus really was around two things when it came to patient payment process. One was to create a good patient experience. So we had challenges just like everybody else. Our payment form online was not the best. It wasn't clear in terms of how we collected information, how we, confirmed payment. It was very challenging. Our statements were kind of defragmented across the different companies between our physician practices and hospitals. And just overall, it was a bulky experience. So we wanted to improve that. And Patient Co, like the others stated, have a lot of different components that go into that. But the other piece is we wanted to position ourselves for price transparency. And in New Jersey, and I know this is happening in other states, there's legislation coming out about price transparency. But we knew in order to get to that level, we really needed to clean up our payment processing. We needed to make it easy for people to understand what their bill was, how to pay it, giving them different avenues to pay, setting up self-payment plans. And Patient Co provided every single one of those things. In addition, on the employee side, as Chris talked about, because of the way our process was set up, it was very manual heavy in terms of employees interacting with the billing process. So we had a lot of manual work going on in terms of how we were processing the bills. We had, different lock boxes and put different postings at different times, different days. So it was very challenging to run, to get the data and information that we wanted to run. Our employees were doing a lot of manual work, so they weren't able to proactively work these statements and be a little bit more proactive with our patients. So the tools that Patient Co provides on their platform are really impressive in terms of how they organize things and simplify it for our employees. So while we gained a good advantage on the patient side, we also gained some advantages on the employee side as well. So.
Thanks, John. And we'll stick on that theme just for a second. So we'll kind of establish a little bit of the prior state. I want to dig into this concept of team workflow improvement and the efficiency that you mentioned. John, this is a snapshot of some of the results that INSPIRA has seen over the past year or so. Would you mind walking the audience through a little bit what we're looking at and why it looks this way and kind of tie it back to what you just talked through?
Yeah, absolutely, Chris. So as you can see, as we implemented Patient Co. Now, ours, I think, was a little bit different in terms of how we implemented the system. And again, this goes back to what Mike and Andrea talked about with Patient Co. really partnering with us. We were, again, going through a Cerner implementation. We weren't quite up and running on the physician side. And so our implementation, we split it out. So we didn't go with a big bang approach on the Patient Co side. So we moved our hospitals onto the platform first. And then we eventually moved our physician practices and urgent cares next. And inside of those implementations, we actually broke apart the different components. So we didn't go all in one shot as well. So you can kind of see from left to right, we went up with the platform first, which was really the web portal and the employee portion of it. And then we started opening up the different self-service components of it. And you can see as soon as we kind of started that, process and got into it in October, we started to see a pretty big conversion. And this is actually for and Chris, correct me if I'm wrong, for our physician practices. Our hospitals actually started even earlier than this. But what was most impressive about the conversion was the change to our self-service payment. So I think it's something like, and I didn't have it right in front of me, Chris, but I think it was like 90% or so total self-payment plans or payment, components in terms of how the patient's paid. And we just continued that trend. Now, I know there's a little bit of probably of an impact from COVID. But overall, we haven't really seen that change. And so, our patients are taking full advantage of every option that Patient Co offers. And I think that's key too. Some of the other vendors that we looked at were very heavy on getting rid of statements and making everything web portal based. And I think that was one of the unique differences with Patient Co. They really did their homework in terms of studying the market and realizing that not everybody's going to do that. Some people are going to want to call the IVR phone system. Some people are going to want to, go through the lockbox, and other people will use the patient wallet and eventually convert over. But the key was providing options for the patients to pay. And I think that's why we've been so successful in converting to self-service payments, even though not every single one of them works off of the patient wallet. So.
Yeah, I draw from my consulting days. Healthcare is a beautiful industry if you want to look at process improvement, right? There's so many areas to improve. And so focusing on shifting that needle to digital is really important, but you don't want to alienate a population if they prefer to pay a certain way. So I feel it's really important to have that flexibility. Andrea or Mike, before we shift to the next slide, any commentary or thoughts that you want to share from your end? All right, let's flip to this next slide, and I'll do the fun hidden quotes here. I wonder who these three people might be. But as we talk about the health system experience and talk about some of the staff efficiencies, we've got a lot of focus that goes into making it easier on the staff, and how does that translate to making things easier for the patients? One of my favorite things that I like to do when I go in, and any of you have heard me on a webinar before, you've probably heard me say this. When we go in to implement a client, we always do a current state assessment. And when we see those situations where there's the literal chair swiveling and where there's staplers coming out and all kinds of printouts happening at the end of the day, that's an opportunity for us to get a grin on our face and know that we can make things easier. And it does help with the health system's operations, but it also helps with throughput on the staff. Andrea, I'll flip to you real quick and ask you to share a stat about what your customer service team saw when we went live, if you don't mind, and talk about how that helped from the patient experience perspective too.
Sure, Chris. I think for those of us that have to work with customer solution centers, or our customer experience lines, our collection teams, seconds really matters for the productivity of those teams. And prior to our implementation of Patient Co, it was laborious for our staff to actually have to process a telephone payment. And now we're in a position now where we've shaved off, quite a bit of time, anywhere from 30 seconds to a minute, depending on what the type of transaction was. And so to be empowered with that additional time in the workflow really is meaningful for the staff. And then on the front lines, as I mentioned earlier, just having a partner that had an integrated solution with our platform, Epic, and reducing the keystroke entries and logging on the multiple systems really is a time saving, not only for the staff member through the process, but just even through the patient experience. It's a more seamless experience for them. And so just to be able to do that at this point really has been meaningful and continues to be powerful for us as we continue to make changes in our workflow and really open up that opportunity for our teams to be able to spend time on other things of value to us for process improvement that frankly, they weren't able to in the past. And so now we're in that position to continue doing that. So we appreciate that streamline came to us through this implementation.
That's great. And Andrea, I'll stick with you for a second as we kind of segue to that patient experience side of things. Before I do that, I do want to make a shout out to the audience to leverage the Q&A tool. If there are questions that are coming through, we've got our moderators reviewing things. So please enter in questions as we're chatting through. We want to hear from you all, and we'll take pause a couple of times to answer questions as they're coming in. So John covered that COVID dip that we saw, and a few of us have had the chance to discuss some of the silver linings that came out of it, particularly from the patient experience side of things. Andrea, I'm going to flip to some Piedmont data right now, and I'd love for you to walk through what you all experienced from a technology engagement perspective as COVID hit and some of your observations from that.
Yeah, sure. Just ahead of COVID, before we knew our world was going to change in the healthcare setting, we implemented e-check-in through the MYCHART functionality. And so that was a portal for our patients to be able to self-check-in for upcoming appointments, whether that was in our ambulatory practices or our hospital-based outpatient departments. And in February, we actually turned on the capability for them to make payment through that process. And then March came. And we immediately became in this place where how do we embrace more of a touchless experience for our patients and really embrace them to be able to self-serve. And so when they came into our organization, again, whether it's through our practices or in some cases became telemedicine, or for our hospital-based services before we started, modifying the volumes on that, patients were able to go online. And if they were already a MyChart user, we were able to promote that to them. And not only were they able to check in with their financial and demographic information, they were able to make payment. Then they were able to promote that through the scheduling process. So as patients made scheduling appointments with us, we promoted that. So we've had this phenomenal adoption, as you can see on the graph there. Just the prepayment that we've now become through that process has been powerful. Again, self-serving. And in that platform, patients are paying predominantly only by credit card or by debit card. And so just that transaction itself is a very easy one to process in our organization. And really just the growth, it was organic, and the timing of COVID and people wanting that contactless experience really just promoted the adoption, and we're continuing to see that today.
Oh man, I just did the classic muted thing. So there we go. Gotta love it. John, I asked you a really great question, and we'll repeat it for everybody. This is so much fun. John, as we compared this, that shows kind of that organic digital adoption to what we saw with the INSPIRA slides, where we had that shift to self-service. I'm curious, either John or Mike, what INSPIRA and Cone might have seen within the COVID era as far as patients adopting either digital platforms like Patient Co or otherwise, if you all have any observations there.
Yeah, I mean, so for INSPIRA, I don't know. I mean, we loaded up definitely way before COVID hit, and I think our conversion to self-pay options were just, I mean, better than we ever thought they were going to be. I mean, our one hospital is in one of the poorest and sickest counties in the state. And so we weren't really sure, how patients were going to interact. We weren't sure how much they were going to use the wallet versus the IVR. All we knew is that we wanted to provide a lot of different options and so that they could pick and choose what was best for them. So when COVID hit, I don't necessarily know that we saw too much of a change. I mean, on our chart, you did see that our self-payments definitely increased. But I don't know. I don't really see us going backwards in terms of the adoption, which is, again, I don't know if that's more related to COVID or just the patients are starting to get used to this process. But, that's kind of my observation. I don't know if Mike had anything to add from his side.
We, of course, saw a decrease in our payments. We saw increase in communication on the portal for asking for assistance deferrals. And we actually stopped our collection calls beginning in March, and we didn't turn them back on until May. So we just sent statements, and we did still see a good response from the patients off the statements. But again, most of the time we were dealing with extending payment plans, people asking for financial assistance, and they were able to communicate through the Patient Co portal.
Thanks, Mike. And I'm going to stick with you here too. It's your turn to be up to go through the data piece in just a second. I think what we saw holistically across the data that we have was this big ratchet up. Obviously, when there's no in-person available during COVID, you're forced to go into self-service. And we were thankful that the efforts we had put in for many years to make it a seamless and easy experience paid off, because we're getting that retention. And so, Mike, I think that actually leads nicely into this next section here. When we think about digital engagement and thinking about reaching out to a patient base that, via digital mean or via mean that one might not intuitively think pays off. And, Mike, I'll be the first, and I'll try to avoid the bozo designation by saying that you've partnered with us for many years, and you've been a really strong advocate for these digital means. Do you mind just talking through a little bit about what you've been able to do at Cone in partnership with us in order to increase digital adoption with your patients?
Well, I think it all starts with educating the patient population of services that you have available to them. And so, we asked for digital from PatientCo. We wanted electronic statements. We wanted the capability of being able to text a notice to the patient on their cell phone so that they could hit the text and it would drive them to their patient wallet and make a convenient payment while they're on the run, grocery shopping or anywhere else. I'm hoping that they make their payments. So I think that's the state of our nation, is that we want things that are easy, right? And our patients have been spoiled by the airlines. I refer back to the airlines and how they made it easy to get a ticket, go to the not having to go to the counter, going straight to the gate. That's what patients want also. And they want to do seamless transactions. They want to also register seamlessly, and they want to register possibly in their cars before they get there, before the time of service. So that's what we pushed. And as you can see by this statistic, we had an increase, 66% increase in our patient wallet creations because of this, what we felt was a digital first option for our patients. And again, it also is a cost saving to us. Of course, the CEO of PatientCo didn't like that, and I kill about that with him because, when you send a paper statement out, you got to pay postage and all. But when you do electronic statement, you're saving greatly the cost to the health system and also text messages. So we were a big advocate of that, and that's also reduced our cost, which is very important in this COVID period of time.
Yeah, thanks, Mike. And if I can elaborate on that just a second and help address one of the questions that came in too, we have a tool that allows us to leverage the emails and cell phones captured at registration along with consent to make that first bill go out electronically. And so that way you don't have to wait for that paper bill to sign up and engage in digital billing. It just goes to you via email or text right away based off of your preference. And so we've been doing this with Cone since the beginning of this year and some other clients as well going into last year. What we found, this goes back to that concept of not everybody's shifting to digital. We don't expect that, but it's effectively doubled the adoption of patients who, when they got those emails, they went into the patient wallet, and now they're engaged digitally, and now that they can check all of their bills that they've historically had with Cone or whomever they're with, and they can communicate that way. Again, having that safety net feature, if they don't engage with the email, they'll still get that paper bill. We don't want to lose out on engaging with that patient and communicating some way. And so to one of the questions in there about getting written authorization from the patient, that's part of our implementation of this process. So the question was, do you need written authorization from the patient to be able to text them regarding finances and outstanding balances? We work with our health systems. We've got best practice template language to use for consent forms. And we work together to make sure that the appropriate consents are gathered at time of service or prior to service so that they are opting in for that communication. Any other commentary on this from the panel or questions from the crowd? Okay. keep monitoring that. I want to shift now just to kind of what is the outcome here? What are we trying to get to, right? And I want to highlight some of the feedback that we get from our patient Net Promoter Score. Every time a patient engages with Patient Co's portal, they have the opportunity to rate their visit. Based on their financial experience, how likely are they to recommend Cone Health, Piedmont Healthcare, and INSPIRA Health to a trusted friend or colleague? And it's great because it tells us a couple of things. One, I would say the majority of the responses that we get and the comments that we get from patients are actually very much related to their clinical experience. And so it goes to show that regardless of whether you are separated from the clinical side and dealing with the financial side, the patients don't think of it that way. So it's crucially important to make sure that they have an easy way to engage in their bill and get questions answered. And two, on the whole, we've got a really satisfied base of patients that are using the Patient Co portal. They're happy with these wonderful health systems, and they're happy with the platform that they have as well. A positive 53 NPS is on par with some of the top brands out there. And we're really pleased to be able to get this feedback from patients. And this is how, along with feedback from our clients, we can understand how to make the portal even more intuitive and easy to use for the patient base. John, I'm going to put you on the spot and just ask you the question that I know you don't have the answer to, but how did this compare to INSPIRA prior to coming onto Patient Co?
Yeah, so we don't have that answer. One of the challenges that we had prior to Patient Co was it was intense to try and even get a baseline as to where our customers were our patients were in terms of our payment processing. So we really couldn't run a lot of good baselines. We couldn't run a lot of good data to even tell you. And I'm sure there's other hospitals and healthcare systems out there that are trying to have the same conversation with their CFO as we went through it. It's challenging when you don't have those baselines as easily ready to go with the amount of data that we wanted to make that argument. But moving to Patient Co, we get a ton of feedback, and I can vouch for what Chris is saying, that most of the positive feedback, people love the system. They love the ease of it. They love the flexibility of the tool. We see a lot of questions actually, again, on the price transparency side of things. So when people aren't happy with Patient Co or our patient payment processing, it's rarely has anything to do with the system and the way it's processed. It actually has more to do with them, with patients not understanding their bills or, not being clear about what it is they owe, and that whole piece of confusion. So now that we've implemented the tool, we now have the ability to go back and look at that NPS score. I believe ours is around 66 or 65, something like that. I should know that off the top of my head.
Stop bragging, John. Come on.
We're really happy with it. And we're happy with the tool itself. So
that's great. I want to take this as an opportunity to tie together the next steps. John, you hit on price transparency, and we're looking at what we've seen today are a number of positive things as far as engagement on the digital front. Andrea, I'm going to steal a line that you shared with me last week of, tying this back to the integration piece, right? Patients don't care how many vendors you have going on behind the scenes. They don't care how many tools you've got together. They just want to have one cohesive place. Healthcare seems, however crazy, to just be getting more and more complicated. So as we have things like price transparency and other things coming on in the months and years to come, what are the areas to tackle next? And since I quoted you already, Andrea, I'm going to float to you to kick you off here and get your thoughts on where should we be looking?
Well, I think it's just that point. They want simplicity is what our patients want. They really drive and look at their healthcare as a consumer. So not only do they expect to receive good healthcare, but they want it to be price effective. They want it to be seamless and integrated. And to Mike's point earlier, they want it to operate very similar to the way they experience business with other industries. And so I think as we look forward to what needs to be next in our space for this, one of the things that we're interested in is providing financing as a more available tool for them. And so, of course, we do have that partnership that we leverage through Patient Wallet with a financing vendor. And so that was able to provide a self-serving option for our patients to be able to leverage and do that. And then to be able to turn that into something now that they can carry in at the beginning of their healthcare experience is really where we're going to be headed next. And I think as an industry, that is where consumers want us to be, is to focus in on that, make it portable and something that they can, really take away the burden of the financial concerns that we all have around our healthcare expense so that they can focus on their clinical care and the care that their families need. And so I think that's our job, is really to care for them as best as we can financially so that they can focus on their clinical and recovery and their healthcare needs.
Very well said. Thank you. Mike, I'm curious on your thoughts. Looking into the next few years, what's next? Where should the efforts be?
Well, I think a patient wants a one-stop place to go, right? One-stop shopping. And so, as I've suggested to Patient Co, that one of the next things you need to do is to have the EOB in the patient wallet. Patients get these EOBs in the mail, and they get it in an email, or they got to go to a insurance company's website to pull the EOB to match it to the statement. Sure would be nice if that EOB was right there in your patient wallet next to that statement, and you could just click on that EOB and pay. So again, one stop. I think that's important for the future. I think the other aspect of it is they want convenience, right? And so they don't want to have to send a message or call into customer service to request an itemized statement. You would be amazed at the number of itemized statements that were asked for. And so maybe you could incorporate the itemized statement in the portal to make it more convenient for the patient, and especially for tax season if they would like that. So I think, again, you're getting the same message, convenience to the patient. They want that one-stop satisfaction.
Yeah, Mike, that's a great call out. And I think you distill out that key point of there's so much information out there that a patient needs, and how do you make it so that they can easily look and compare? And as you know, we've been working with Cone and others on exploring, how do we create that effective look at what that EOB landscape is? How do you make sure that you're calling out and explaining, well, Blue Cross says this, but Cone says this, and why, right? And that's a lot of our focus and development as we look into this, because that's the crux of price transparency. It doesn't matter what kind of list you have if the patient doesn't understand it. So being able to translate it that way, great call out. I see that there's a couple questions coming in. John, I'm going to flip it to you just to kind of give your thoughts on what's next, and then we can take some time to address some of the questions.
Yeah, Mike and Andrew hit pretty much the ones that I would mention. I mean, again, I know I kind of sound like a broken record, but for INSPIRA, we're really trying to tackle this price transparency piece. So giving patients the ability to see exactly what's coming down the pike, and being able to, flip that right into, a payment plan, or, being able to, and I know this sounds kind of bad when you say it out loud, but shopping around. I mean, giving them the ability to look for the best care that provides the best quality for them and meets their financial needs as a family. So I think that's really important to us, and I think that should be part of what Patient Co looks at moving forward.
Great, thanks. Any other questions from the audience? I see one in here. Does Patient Co integrate with a provider's estimation tool to drive pre-service collections? The answer is yes. And we have admittedly, debated this quite a bit as an organization. Do you integrate with what the provider has, or do you offer something separately? I think in some cases it makes sense to consolidate vendors. This is an area where depending on your managed care mix and depending on the tools that you have, we felt that it was really important for Patient Co to be a platform that would work with whatever estimator comes through, be it through an integration or processing the payments, or with our pre-service product, really going out and providing that outbound communication to the patients as well. So great question.
Hey, Chris, you might want to talk about, you have a hotkey in Epic, and the hotkey in Epic, as a customer service representative is working in Epic, and say they have a price estimate that they're giving to the patient, and the patient is making a pre-service payment. There is a hot link within Epic up at the top that allows all that information to transfer over from Epic, all the demographic information, and it flows over to the patient. Patient code pops up, and so your customer service reps don't have to enter as much information.
Yeah, Mike, that's a great call out, and I think that addresses two things, right? For Cone, that's one of the key integrations that we've put together is this smart link that we have that brings over the key information from Epic, so that you, as your organization has decided you want to keep everything within that Patient Co platform. And that's similar to how INSPIRA is working as well. Payments are processed within Patient Co. Andrea, you can chime in and keep me honest here, but the payment flow within the integrated landscape at Piedmont is actually all within Epic. And so I think that's as we look to what's next. The good news is, from a patient's perspective, they don't know who's processing that payments behind the scenes. They're still having that same seamless experience, and we're working to tailor whatever works best for the given health system's needs. Let me just take a look. Are there any other questions from the audience? I think we're hearing a few key things as we're looking into next year. Where's that integration going to be? And actually, I'll ask the question to the audience in general. When you look at a patient payments, patient communications vendor, are you looking for somebody that's got that one-stop shop for everything, or are you looking for that ability to mix and match? And how do you approach that? How do you think about that? I'm not getting the flood of responses I expected. All right, we'll give it another minute. As we wrap up, Andrea, Mike, John, thank you so much for joining us today. It's so great to hear the perspectives from our partners on how they've been able to work on the Patient Co landscape, and as always, it's great to see you all, at least virtually, in this world. I think there's a couple other questions that are coming in, so I will pause for a second and see if anybody has anything else to say. Becker's team, was there anything from your all's end?
Yeah, thank you so much, Chris. I really want to thank today's speakers for that wonderful presentation. Please, to the audience, if you have any other questions, please just submit them into the Q&A box you see on your dashboard. We did have a couple more come in, and the first one is, does Patient Co integrate with all EHRs/health information systems?
Yeah, we do, and we have a variety of different ways that we integrate. From as straightforward as posting and payment integration to seamless integration into Epic via the App Orchard. But we don't like to say no to anybody, and we've got a phenomenal team that works to make sure that we can get all the pipes connected.
Thank you so much. That's so helpful to understand. So I know the next question, you touched a little bit on integrating with a price estimation tool already, but another audience member would like to know what other existing technology Patient Co integrates with, kind of beyond that health information system.
Yeah, that's a great question. So kind of blending the two types of integrations that Patient Co has, which is the payment and then the broader health system landscape. So yeah, we absolutely integrate with the patient accounting system, the system of record. That's typically our core one. But we've integrated with a number of other tools. Andrea mentioned we integrate with several different financing vendors within the platform so that patients can explore financial options all in one place right there. We have we've worked with different IVR vendors with some of our partners. We've also got a number of tools behind the scenes that are integrations that you wouldn't necessarily recognize, because that's the intent, to make sure that everything is seamlessly tied into there. As we think about pre-service, right, that's where it may be integrating into Epic for certain things, or a separate estimator, or a scheduling tool. We view ourselves as the patient communications platform, and our job is to be able to ingest data that comes in and make sure that patients have one place where they're getting their communication for their patient financial experience.
Thank you so much. That's awesome that you are integrating so much into the Patient Co platform. I think we have time for one more question today. So that question is, how has the pandemic affected how you think about staff workflows and technology needs?
I have an answer. Can I turn it over to the group? I think they're the ones that are working a little bit more. Mike?
Well, for us, we fortunately thought about this. We knew that this was going to happen. No, I'm just joking. We back in July of 2019, we went remote for most of our patient accounting staff. So from a remote perspective, we were already there, so we didn't have to hustle and bustle due to COVID. So from that perspective, we were prepared, and the technology that we had, our IT team came through, and a lot of it, we don't allow printing at home for our staff, and we have some on-site staff to take care of the printing queues that need to be taken care of. But from our position, we didn't miss a beat, because again, we had done this back in July of 2019.
John, I know you guys did quite a big push when COVID hit. You mind sharing what INSPIRA did?
Yeah, so we from a remote standpoint, kind of the same boat as Mike. We were just converting over to our Teams platform, and we were starting to do some things remote. So in terms of that kind of scramble, that we had a pretty, I wouldn't say the best handle on it, because I think all of us were surprised by everything, but we did a good job kind of managing that. Our focus was really kind of around building visibility for COVID with all the different systems, and just kind of integrating things so that we could quickly get to answers, whether it be lab testing or just really anything that we needed. And we also focused heavily on our kind of recovery program from a financial standpoint, because there is that financial component to everything. So those were kind of our key areas that we focused on. But coming out of COVID, I think that there's no doubt that one of the focuses that we have is automation, AI and automation just in general, and that's really helping us to link systems together, kind of integrate systems, making it seem seamless from an experience standpoint, so that our clinicians and everyone can focus on the clinical pieces that they need to focus on, and not be so hung up on some of these other issues that we have. So
great, thanks. Andrea, any thoughts?
Real quickly, we at Piedmont did need to embrace sending our revenue cycle teams home to be remote workers. So we did do that. We deployed 600-700 people within a 2-week period to be remote workers, and has worked well to the point that we are going to stay that as our model going forward. So now looking at how do we recruit different, how do we structure different, so just changing that landscape. And then one other thing that we did, which was something I never thought we would do, which is we embraced a contactless registration for our emergency room patients. And so when there was that situation where we were all fighting for protective equipment, and it was really important for the clinical partners to have that first, we knew we still needed to do our part in registration. So we went to telephone-based and call center-based telephone registrations for the ED. Didn't solve for all patients, but did for a large majority, and we are now looking forward to embracing that as we move forward. So it's working well, but it certainly was as a result of COVID that we embraced it and tried it.
The silver linings we find in all of this. And this is my remote office that we moved to as well. So we're living that world right now. Well, again, thank you, everybody. Aaliyah, were there any other questions from the audience that we missed at this point? I guess we're at time.
Yeah, that question brings us to the top of the hour. So unfortunately, that is all the time we have left for today. I do want to thank today's speakers for their excellent presentation and Patient Co. for sponsoring today's webinar. I hope you enjoy the rest of your day, and we look forward to having you join us for future webinars.
Bye, everybody.